I know this is an afternoon session, so my intention is that we are going to help each other, that I will do my best to make it engaging, and then, for you all to sort of to engage with what you're hearing, react, whether it's, in the chat, and then also you'll have opportunity to unmute and also be able to contribute to the conversation. So just a little bit about me. I started off in early childhood education as a teacher assistant in a preschool classroom. And then I was a head teacher also in the same center, and then was a program director for many years. In our early learning program, we served over 90% of our families were low-income families, immigrants and refugees. So lots of English language learners. And it was just a neighborhood over from where my family and I settled when we first came to the US. So really enjoyed that experience, and then moved on to systems work, which that's my current role. So
Oh, and Grace, you were
sorry.
Grace, that was my fault. I was admitting someone and muted you by accident. I'm sorry.
Okay, I thought I might have done that in the space bar. Like I thought I got this Zoom thing down.
Nope, that was me.
But no. Sure. So I don't know how much you all missed, but just I started off as a teacher assistant in preschool classroom, and then transitioned to this role 3 years ago, where I'm the director of community systems, statewide supports at Illinois Action for Children. And so the project that I lead, my team and I, we design a statewide training and TA system for early childhood collaborative. So really exciting work. We haven't done something with this scope in Illinois. And so I'm happy to share what we've learned and sort of what we've done, and hopefully it can inform your work as well. In terms of my organization, Illinois Action for Children, our mission is to be a catalyst for organizing, developing, and supporting strong families and powerful communities where children matter most. And so we've been around since 1969 and always responding to this question, what about the children? And we do this through advocacy and public policy, research and evaluation, as well as innovative program design and development. Last year, we served 113,000 children, 63,000 families, 36,000 providers, and 4,000 advocates. And we are the child care resource and referral agency in the largest county over in Illinois, where the Chicagoland area is. So let's get started. Okay, so our objectives for our time today is first to articulate what are the capacities that are needed to effectively engage in system building. So we'll take a look at that first. And then we're going to explore supports that are essential to building capacity for system building. So I'll share what we've been doing in our work. And then you'll have opportunity to sort of think about your system, to evaluate your system for building capacity, whether that's at the local level, county or state level, to think about, what are you all doing in terms of to effectively support folks in system building. Here we are. Okay, so let's do a quick poll to see who is in the virtual room. So what best describes your role? You're a state administrator, a TA provider, researcher, collaborative leader, advocate, Smart Start local partnership staff, a funder, or other. And if you end up picking other, please go ahead and put into the chat what that role is. All right, some other roles, directors. Okay, so childcare directors, mental health consultants, early intervention service coordinator. Great, thank you. Parent educator, some of those other roles. Okay, let's see. We have about close to 80% of folks that have voted. So why don't we go ahead and close the poll. And so we have a majority of folks that are Smart Start local partnership staff. And then another group, other, which you all have been putting into the chat. Thank you for doing that. And then another area folks are in is TA provider as well. So thank you all for sharing. And then quickly, just curious, what intrigued you about this session, or what are you hoping to get out of the session? So if you could just respond in the chat. What are you hoping to get out of the session? Okay, so curious, interest in systems change, how to bring in cohorts of community services to look at groundwater approaches. Okay, to better collaborate with local agencies, the process of redesigning our systems building, great. How to collaborate with local agencies. Okay, perfect. And so again, I do invite you as I'm going to start to share what we're doing. If you have a question, please go ahead and put it into the chat, or if you want to make a comment, feel free to unmute yourself and make a comment. Okay, so how we'll spend our time together, we're going to talk a bit about system building. You'll have an opportunity to be in a breakout session to talk about what you believe are the capacities needed, right, to engage in system building. And then we're going to look at what are the essential supports that we sort of incorporated in our TA system. And then you'll also get a chance to get in breakout groups again to think about how might different types of supports be essential in building folks' capacity to engage in system building. And then finally, you'll get a chance to evaluate your system of supports, and then you'll get a chance to do that in a breakout room. So lots of opportunities for small group discussion, but then also contribute to large group, like I said, through the chat. Okay, so what do you think of when you hear the word system building? If you all could just share in the chat. What do you think of when you hear the word system building, especially as it relates to early childhood education? Okay, someone said collaborate. Yeah, collaboration is a huge part of system building. Relationships and connections, communication, infrastructure. Yes, that's really important. Strengthening communication feedback loops. Yes, great. Convening, making it better for all. That's right. I'm sure you all probably have seen, and if you haven't, you can Google it. I mean, you can look it up on YouTube. The Build Initiative put together a video of what is systems building. So I'm not going to show that, but that's a kind of great video to use, especially as you're trying to engage folks in this work and you're having a hard time explaining. I know I found, and my staff have said, and early child collaboratives have said, sometimes it's hard for us to explain what we do. And so it's a short 2-minute video that explains what systems building is. What about systems thinking? What do you think of when you hear the word systems thinking? Seeing the bigger picture, multi-level, process and procedures, thought process, facilitating ideas. Great, these are great. So when we treat things as systems, it makes us think differently, right? Providing insight and understanding that could not be gained in another way, right? So one level systems thinking is a mindset, right? It's a state of mind. And another, it can be organized, repeatable, and a powerful approach that all people can learn to apply. So let's look at a bit of system building first, and then we'll define systems thinking. So some of you may have seen this graphic before. It's from the Early Childhood System Working Group. And as you see in the center, the outcome in terms of the North Star that we go for in systems building is thriving children and families, right? We want to improve outcomes for children and families. But it incorporates the early learning sector, right? Early learning and development sector, family leadership and support, as well as health, right? So all these different sectors coming together to support children and families. So if we were to define it, it'd be defined as the ongoing process of developing the structures, some of you said this in the chat, behaviors, and connections that make all the components of a system operate as a whole, right? To promote shared results for children and families. I'm gonna put, when I put you all in the breakout room, I'm gonna put in the name of the YouTube video, Carrie. It's just gonna be a little hard for me to put it in right now while going through the slides, but I'll make sure when you all are in breakout groups, I'm gonna put it into the chat. So continue to ask questions. Thank you for that. Okay, so habits of a systems thinker. This comes from Waters Center for Systems Thinking. They recently, you all may have seen it, habits of a systems thinker. They updated the graphics a bit. And so there's 14 habits that they talk about. And so I'm just gonna share a few here. One is observes how elements within systems change over time, generating patterns and trends, right? So the ability to be able to do that. So as I'm sharing these habits of a systems thinker, I want you to think about, because you're going to be in breakout rooms soon, is to think about how do we develop capacity for system building, right? And what are some of the capacities that's more difficult to sort of to build? And so as we go through these, I want you to be keeping that in the back of your mind. Another is considers an issue fully and resists the urge to come to a quick conclusion. So some of you said that in the chat about looking at a big picture, right? I know sometimes this happens when we're working with families. You know, I know some of the collaborators we're working with, when we talk about enrollment, they say, well, this specific group of families, they think children should be at home, and so that's why we're under enrolled, right? And so they come to a quick conclusion, but we don't know if it's been fully investigated or it's been fully engaged with the community around that. Another is uses understanding of system structure to identify possible leverage actions. And so when you're looking again at the whole structure, looking at what is one action that we can take that would really improve the system, that would really move the needle, right? And so those are things that we're working with collaboratives on a lot. Another habit is checks results and changes actions if needed. So successive approximation. In our work, we refer to this as action learning, or you may hear people say ideas of like failing fast, right? You try something out, you evaluate it, and then you make changes, right? So very sort of quickly. Another is surfaces and test assumptions, similar to some of the other habits, but again, really looking at the assumptions that we might have. Changes perspectives to increase understanding. Oh, great, Ren, you shared the video on the build video on systems building. Thank you for that. And then another is considers short-term, long-term, and unintended consequences of actions. So really playing it all the way through. And sometimes it's hard for us to think of all those things. That's why it's really important in system building that we're engaging a diverse group of stakeholders, right, that can provide that perspective. Make meaningful connections within and between systems, right? And so in the graphic that I shared, the ovals, right, making connections between how is early learning connected to health, right? We know those things very much affect children's outcomes, right? And so making those connections, even though sometimes programming, funding, or things might be sort of siloed, we have to be able to make those connections. Considers how mental models affect current reality and the future. So how we're thinking about something definitely affects the way we see it, right? And so again, this also is connected to sort of surfacing and testing assumptions. So just shared a few with you all. Like I said, there are 14 of these, and I encourage you to visit the website. But we found these to be really helpful as we were thinking about the TA we would provide for early childhood collaboratives. So now I'm going to invite you to get in a breakout room, and what you're going to discuss is what capacities are needed to effectively engage in system building. And then if you have time, also look at what capacities are the most challenging to build. And so you'll be in small groups. You'll be about 4 people in a group. You'll have 10 minutes to discuss. So have a great conversation, and we'll be back to talk about the supports that we built out in our system, in our TA system.
Grace, just to let you know, I see people joining rooms.
I'm not able to see the participants. Is it my view?
During the breakout, you may not be able to see them because they're all joining other rooms.
Yeah, but I would still be able to see you all screen, right?
If you go to more and then click on join breakout, it won't make you join, but you'll be able to see where everybody's going.
Okay. Okay, I see where everyone's gone to. I just mean the oh, let me do this. Here it is. Okay.
Hi, Amy. We can put you in a different room so that you have other attendees in there with you. Just give us just a moment.
Yeah, I'm looking through the rooms where there's just 1 or 2 people and moving them to another one so that people have more people to talk with. Okay.
For those of you still in the main room, if you'd like to be in a breakout, please click more and then join breakout. When it comes up on your screen, you can join your breakout.
How many more minutes are in the breakout rooms?
We have about 4.5
Okay.
remaining. I'm going to give a 2-minute warning
Okay.
and then another 1-minute warning.
Have a
Okay.
good one.
Welcome back, everyone. All right, so we have time for maybe 1 or 2 people to share. What sort of bubbled up in your conversation? So again, you all were looking at what capacities are needed to effectively engage in system building. And then if you had time to think about what capacities you found most challenging to build. So you can feel free to unmute or put in the chat. We have time for 1 or 2 people to share.
My group talked a lot about having a listening, learning mindset and having that approach too, and listening to families and making sure all of your stakeholders are involved in whatever work you're doing.
Mm-hmm. Yeah, that's interesting. Go ahead. Was there someone else that was going to jump in? Yeah, it's interesting. Thank you for sharing. We found that when we first started our work, before we went about designing the TA system, we went around and we spoke with all the early childhood collaboratives, and in a moment you're going to get to see our state and how many collaboratives they are. But we interviewed the leadership and all those collaboratives to ask, what do you find most challenging about your work? What do you need support in? And one of those areas was around authentically engaging families at that systems level, right? So not necessarily programs being involved in early learning programs, but engaging families on the collaboration level. And so yes, that was definitely a challenge. Okay, anyone else want to share?
We talked about building relationships. That was really key to capacity building. And then the challenge on the counterpoint of that is when you have changes in personnel, and then you have to rebuild the relationships all over again. And so that is always a challenge. Yes,
that's really interesting that you bring that up. We did certainly put that in terms of our values. We even started doing something with co-coaching. So I know we typically have, one coach assigned to a community, but we started to have 2 coaches kind of working together. So I think that can help with what you just talked about, one of the challenges when a person leaves. Let's see, someone said, Debbie said, need alignment. At the local level, we are wearing multiple hats. That is absolutely right. Especially in small rural counties, we desperately need our efforts to be able to be focused on things that move the needle the most. Yes, we definitely have found that in some of our rural counties as well, but really across the board. I mean, collaboration work is not something that you see results right away, right? You're in it for the long haul. And so keeping partners engaged can be challenging. So thank you all for sharing. Okay, so we're gonna now move on to what we've done in terms of the supports that we've provided to that were essential for system building. So just to give you a little bit of context, for over a decade, Illinois Action for Children, we've led community systems development efforts in our state. We started off with Building Blocks 2 project, and then the Early Childhood Action Partnerships, where we were the primary provider of training and TA for community collaboration leaders in Illinois. And then with the Race to the Top Early Learning Challenge grant, we were able to establish what we call innovation zones, as well as the Consortium for Community Systems Development. And so what the innovation zones did is they tested strategies to increase enrollment of children with very high needs and high quality early learning programs, and then informed the state on best practices around that. And then what we did through the consortium is that we partnered with Michigan State University. Some of you may have heard of Able Change, to help deliver training and coaching that was focused on the Able Change framework, so that we can have a common framework and shared language around the state when we talk about community systems development. And so we used all that we've learned on these different initiatives to inform in the design of our current project, Community System Statewide Supports, which we call CS3. So you'll hear me refer to it as CS3 because it's a mouthful to say Community System Statewide Supports. So CS3, in about 3 years now, we've been engaged in this work. And so the CS3 project, it was funded by Illinois State Board of Education in partnership with our Governor's Office of Early Childhood Development. And our purpose really was to develop a statewide training and TA system. to build the capacity of community collaborations to improve early childhood education systems. So this is a map of Illinois, and what's important to note, there's lots of colors, and so that's not really important for you all to note, but it's really where you see the blue. So wherever you see a blue is where there is not an early childhood collaborative. So in Illinois, we're just beginning to do what a lot of states have done, and sort of creating these regions, whether it's at a county level or these hubs at a very larger level. We're beginning that work now, but up until today, because that work is going to begin in July, it's really been it's been organically sort of forming, and it's been either through initiatives through our human services department called All Our Kids Network, that have a lot to do with health. Also, they're situated in a lot of them in our health department. We have a lot of independent collaborations that are formed organically, and then we have some that are connected to the McVie home visiting collaboratives. And so that's what the different colors indicate, what type of collaborative they are, but they're all early childhood collaboratives. And again, wherever you see the blue is where there currently is not an early childhood collaboration. So that's going to be the work of this regional structure that I'm talking about, is establishing local collaborations across the state. So we started off this work in the very beginning. We started off thinking about what are our core values? What are we bringing to this work in designing this TA system? So we came up with a few. One is that learning happens in the context of a relationship, right? Just like with kids, right? We know children can't learn from you unless they know that you care, right? And so we've done a lot to sort of build relationships across the state with early childhood collaboration. Second is this idea of inquiry, right? Inquiry really being important, this idea of being curious and reflecting. So in our system, we said that we want to develop that. That's a value for us. Another is this idea of action learning, right? In the habits of mind, they talked about this as successive approximation, that we're consistently learning from what we do and improving. So action learning we felt is essential in building capacity and improving systems. And last but certainly not least, equity is a value of ours. So we feel like equitable outcomes in all communities is worth pursuing. So we said, whatever system we build, we're going to make sure that these values undergird all of that. So we have 4 goals in our project. One is to provide what we call foundational supports. And these are supports that are provided to every collaborative. Like we said, there's about 50 early childhood collaboratives in our state. And they can access trainings, our online community, all the supports that we provide free of charge is provided to everyone. But our second goal is to provide what we call targeted supports. And these are for early childhood collaboratives that want to get in-depth targeted support, and they commit to at least a year in our Collaboration Institute. They're assigned a coach, they go through an assessment process, and they're working with us for a year. And so I'll talk a little bit about what we do in terms of providing targeted supports, and you'll watch a video about that as well. So I'll go into it a bit. The other goal is to collaborate and coordinate with existing statewide TA providers to make sure that we're aligning training opportunities. So like in many states, what happens is, we're the TA provider for early childhood collaboratives, but then there's a TA provider for all our sort of preschool for all state funded programs. And so there's a TA provider for that. There's a TA provider for supporting programs serving children with special needs, right? And so we wanted to make sure that through this project that we were also collaborating and coordinating with existing TA providers. So it's not confusing for communities. So if we're asking communities to collaborate, we need to make sure we're doing it on the state level as well. And then finally, our goal was to implement a data and evaluation process to support continued system improvement at the community and state level. So some of you talked about a feedback loop. So we were learning from what we're doing, but then also making sure we're sharing that with the state as well. And so I just want to share a little bit about what our theory of change was, our theory of change is for this project. when we first started, we talked about how, we're going to be providing foundational supports. We're going to be providing targeted supports. And we're looking to build relationships with and among early childhood collaboratives. We wanted to provide strength-based, responsive, and inquiry-based coaching. We wanted to promote evidence-based practices when it comes to systems change, methods, and mindsets. We also wanted to legitimize and define and build the capacity of collaborative leaders, right? So, unlike other roles in early childhood education, like say a teacher or a director, this role of a convener in an early childhood collaborative, it's newer in a sense. And so we wanted to be able to say, these are the skill sets that are needed to do this role and to really legitimize that role. We also wanted to inspire and incubate new collaboratives. As you saw, there are pockets in our state where there isn't a collaborative. So we wanted to be able to do that through this work and have a strong focus on equity. And so as I go along, I'm going to talk a little bit about what we had hoped the outcomes would be, and how they would lead to systems building and then lead to our overall mission for our state, which is that all children would be prepared and arrive to kindergarten healthy, safe, eager to learn, and ready to succeed. And so it's important for us as a team to go through this process of thinking about our theory of change. Okay. And I'm just going to share a bit what our framework was. What did we do with early childhood collaboratives? When they came to our Collaboration Institute, we took them through this process. So where you see the squares, those are all trainings. And so we started off with a training around community assessment and targeted problem identification. So how do you execute a visioning process? How do you identify what it is that you're working on together, right, in this collaborative? How do you access and analyze community data, making sure that you're engaging diverse stakeholders? And so they start off with that. There's a training, and then there's coaching in between. There's about 2 to 3 months of coaching where they're just working on a community assessment and targeted problem identification. Then they come back, and the next training focuses on system scan and root cause analysis, right? So how do you formulate questions to understand issues? How do you compile and analyze data? How do you examine root causes? So they'll attend a training. This is the leadership team of the collaborative. And then in coaching is when they're implementing what they're learning through with the help of a coach. Then they come back again, and the training focuses on designing a strategy. So thinking about what is the systems change strategy that they want to implement based on the problem. And then also thinking about how do you measure the impact, right, as you're implementing a strategy. They're implementing their strategy design, then they come back and do training on action learning. So how is it that you're able to set the conditions for effective implementation? How do you adapt for change? Because what you thought things would look like may not end up being that way. So how do you sort of adapt? So that's the process they go through. And again, like I said, we want to make sure that we're embedding an equity lens in this work as well. And then when they come into the Institute, I mentioned that they do a self-assessment. So there's 2 self-assessment tools that we use. And these 2 tools, community collaborations have said, have been very helpful for them. They identified these tools when we got our evaluation report back as being really helpful to them. So one tool is an analysis of strength and growth areas. So it looks at all the components of a collaborative, looking at their governance structure, their members' roles and responsibility, what strategies that they implement in the community, how they assess data, how they involve parents. And so they go through this process together as a team. And based on that, the coach puts together a support plan, of course, with their input. So they create a support plan, what they're going to work on during the year, and they revisit that quarterly. So that's kind of what sets them for the year and to think about what they're going to be working on. But we also thought that if we're really wanting to embed a racial equity lens to this work, that it's important that when they do that assessment, we call out equity. And so there's a self-assessment around that. It looks at sort of their own understanding of how structures show up, right? Inequities show up in the structures, right? The history of it. Do they have a sense of that? So there's a baseline data, and then they do both assessments again at the end of the year to kind of compare and see whether growth has been. So what I'd like to do now is share a video of the Partner Plan at Collaboration Institute to give you all a sense, and then sort of take any questions about it before we go on.
So the goal of the Collaboration Institute is really to build collaborative capacity. We know that if we want to be effective working together in order to address some of the system and community barriers that get in the way of children and families accessing the services and supports that they can benefit from, we have to be better at being able to work together.
They should expect us to meet them where they are and offer a space and an opportunity to reflect, assess, and grow. You should also expect to be in the driver's seat of this experience.
One of the things that I will take away from my participation in this institute would be all of our agencies have the same goal that I have as a coordinated intake, which is serve our families and just make sure that we remember that we're all together as a team, that we're not against each other, we're for each other, for our city, for our county, and that our goal is just to better serve anybody that is at need.
Well, I think one of the important pieces is that as a collaborative, we realized that we needed to work on structure and governance. And in our self-assessment, we also realized that we were not intentionally addressing inequity the way we should be. And that has given us a lot of things to think about as we move forward in our strategic planning.
One of the things that the Collaboration Institute has done to help build our capacity is help us develop a governance structure and a charter agreement to define the roles and responsibilities of our leadership team and the members of our collaboration. This is very important because as we move forward as an entity, we are obviously going to seek funding and additional support, and so to have a very clear and defined governance structure is critical to our success as a collaboration.
The Institute has supported us to build the capacity to support children in our community, again, with just the trainings, the support, the coaching, the tools that we used, the tools that we implemented, identifying where we want to be, identifying targeted issues and strategies, all of these things in combination.
Early childhood education is critical. I mean, it really sets children up for success for the rest of their lives, not even their school career. We know that it goes into their success with their careers, with higher education, with their health in the long term. So to be able to have such a huge impact early on in their lives, we need to make sure we're doing everything that we can for those children.
Oh, it's the foundation for everything that we have in life, in society. It is the next president, the next airline pilot, the next firefighter, the next police officer. There's wonder out there, and there's so much growth and potential.
One of my takeaways from the Collaboration Institute is that we still can do it. That there's not a need for fatigue or hopelessness. That if we take the time to pause, reflect, take inventory of the strengths that we have in our collaboration, that we can make it through it. And we will. We'll persevere together.
Okay, so I have a question from Katie. What did you use for the equity self-assessment? So we internally had been going sort of through